and welcome to Women's Football Hub. I am your host for this episode. I am Carolyn Kent, and today we're talking about sex differences after ACL injury. And I'm delighted to welcome back someone who has now successfully defended her dissertation for her PhD, which was on exploring sex differences in quadriceps neuromuscular performance after ACL reconstruction. Welcome back to Women's Football Hub, Dr Anne Leung.
Thanks for having me back. It's great to be here.
It's lovely to have you, and first of all, congratulations. That's a very big achievement.
Thank you.
How are you feeling now that you've actually got the reins off and you can officially say that you are a world expert on this topic?
Good. Yeah, I don't know about world expert, but yeah, definitely good to be done. It feels really good to have defended and be through to the other side of PhD at this point.
So we talk a lot about higher ACL injury risk in female athletes, but post ACL reconstruction, why is it just as important to talk about sex differences in rehabilitation outcomes?
Yeah, I think there's two answers here. So one being the rehab process, right? And I think it's important for athletes to be empowered and understand that this is really difficult. This is a really hard and long rehab process. And I feel like when you're in that position, you can be armed with information about how difficult it is, and then you're more prepared for it. And you're more able to work your way through it and be empowered if you know how challenging it's going to be. And there are sex differences during the rehab process where we expect females to not do as well as males. And again, I think it's just really valuable to have that information going in or as you're going through it so that you know that's a normal experience and not get discouraged by it. And then on the other side of it, there's the long-term health implications. And some of the key pieces where we see sex differences and outcomes are in physical activity and return to sport. So we see that females are lower physical activity and lower likelihood to return to sport after ACL reconstruction. And that could have implications for your long-term health and in terms of joint health and in terms of just general physical well-being if you're not as physically active. So I think those are important pieces, again, to arm athletes and patients with that information so they know what to expect and they can be empowered to make changes or go through the process effectively.
So let's dive into that a little bit. Where is it that female athletes tend to struggle compared to males during ACL rehab?
Yeah, there's a few key pieces. So the last time we talked about quadriceps strength and quadriceps performance at length, and I'm going to talk about it a bunch again because that's one of the main areas where we have a lot of evidence that females don't do quite as well as males after ACL reconstruction. We also know that females have lower patient-reported function after surgery, and the difference in that kind of diverges at some point in the rehab process. So early after surgery, in the first few months, we don't necessarily see those differences in patient function. But as we get further down the road, we do start to see that females are reporting lower functional ability compared to males after surgery. And then the other two key pieces, which I already said, are return to sport rates. So we see that females are returning to sport at lower rates than males after ACL surgery, and particularly returning to their previous level of participation or their previous level of sport at lower rates than males. And we also know that their physical activity is much lower compared to males down the road. So if we look at a year out, 2 years out, we see that females who've had ACL surgery are less physically active than males who have had ACL surgery.
So you said there that basically in the early stages, you don't tend to see much of a difference between males and females in the early stage of rehab. Is that right?
In patient-reported function specifically. So there's a recent study that came out that identified at 3 months after surgery, there are no sex differences in patient-reported function. So those are the kind of questionnaires that ask patients, how are you doing? What are you able to do? How difficult are these various different tasks? And then it's scored based on how they answer. So at 3 months, we don't see those sex differences. We see that females and males are comparable in how they score on those outcome measures. But as we get further down the road, we do see that they're scoring poorer, that they don't have the same functional ability on these self-reported outcome measures that males have. For quad strength, we do see differences early. We do see differences as early as about 4 to 6 months. We see that females have lower quadriceps strength than males.
That's interesting. Is there any other difference in, say, for example, neuromuscular control? Is recovery more difficult?
Yeah, and that's an interesting question. I don't know that we really have a good understanding of what the underlying reason is that we see those sex differences in performance or in any of these other measures. Especially early, we don't really have great understanding of what the sex differences are. And based on this new study that's showing we don't have differences in patient-reported outcomes, there does seem to be some sort of divergence point, and we don't really know where that is for all of the outcomes just yet. So in terms of what we see early, definitely strength differences. And where that's coming from, whether that's neuromuscular control or something else, I don't think we have that answer just yet.
Let's look back towards the first podcast that we did together, and we were talking about obviously quadricep strength, and that was a big thing that you spoke about, especially with regards to females and how it takes them longer. It's more difficult for them to rehab. Are you still finding that female athletes tend to struggle more to rehab quads post ACL? Is there been any kind of new stuff coming in to say actually if you do this it might be a little bit easier, or is it just no, it's still the same?
Yeah, unfortunately, I don't really have any promising updates there. So yeah, there's still a growing and very large body of literature that shows females have worse quadriceps performance after surgery than males. This is true at multiple different time points. Like I said, that 4 to 6 month range, we're seeing it. We're also seeing it at 12 months, 24 months. So across the entire rehab process, we do see that females have poorer strength. This is actually, interestingly, also true on the hamstring side of things, but it's not quite as large of a sex difference. So the difference between males and females is a little bit smaller in terms of hamstring strength versus quad strength. We are seeing these kind of meaningful differences between males and females.
Yeah, you mentioned the hamstrings at the moment. When you've had a hamstring graft, trying to get that last little bit back, I can tell you that is not fun. I am not enjoying. I enjoy quad rehab. I don't enjoy hamstring rehab. Stop with the RDLs in the Nordics. I've had enough now.
And strength is so related too to your graft type. What you just said is so true, where if you've had a hamstring graft, it's harder to get that hamstring strength back versus if you've had a patellar tendon graft or a quad tendon graft, it's a lot harder to get that quad strength back.
Yes, I believe the quad tendon grafts are taking a bit of a beating at the moment. There's a lot of physical therapists very unhappy with the quad tendon graft. It doesn't appear to be the most popular at the moment.
Yeah, and I think we're going to probably have that debate and that pendulum swing forever in terms of what's the best graft type and should we go with one versus another. And there's lots of different opinions. I'm certainly not an expert on what graft type is going to give you the best outcomes, but yeah, the pendulum seems to be swinging away from therapists certainly don't like to rehab quad tendon grafts right now.
No, they don't. Let's talk about therapists actually, because obviously when it comes to rehabilitation, the environment and how patients are treated can obviously make a difference. Are there sort of sex-based differences? Are female athletes and male athletes treated differently by physical therapists in rehab?
That's a fascinating question. And I know you know about this study because I know it's come up on the podcast before. So there's a recent paper in the last couple of years. The group was led by Lauren Butler and Sophia Ullman in the US. So Sophia is at Texas Scottish Rite for Children, and Lauren is somewhere in Florida. I'm forgetting where. But they found some slight bias in how physical therapists prescribe exercises for patients based on a patient's gender. So there may be something there where maybe we don't treat our male and female patients the same. And I think there's lots of opportunity to further explore that. And I know that group is continuing to explore that line of research. So I'm really interested to see what their continued work finds and to see what they're able to identify in terms of what contributes to that bias that they found in patient exercise prescription.
Yeah, I think essentially what they found was they were more likely to progress the male quicker than the female. I think that was probably, and it was all done via a sort of video case study, if I remember that study correctly. But yeah, we're not saying that's conclusive, but it does bring in that sort of environmental, what are your biases? Have a think about that when you're dealing with your athlete. Now, let's take it on to another controversial subject that's coming up at the moment. Let's talk about hormone influences in tissue healing. And we can have a think about maybe just rehab in general and neuromuscular control, because we've got that whole argument about training around about your hormones is an absolute no, we don't need to do that. But does it impact on tissue healing? Does it impact on neuromuscular control, especially after ACLR?
Yeah, that's a really interesting question. So I think one thing that's interesting that I don't know if it's been addressed much. So hormones can influence inflammatory biomarkers a little bit. So we do know that females are slightly more at risk for chronic inflammation just from general population studies. This has not been explored extensively or potentially at all in the ACL reconstructed population. But if we look at the immunology literature from the general population, the genetic markers for inflammation are more prevalent in females. And we see greater expression of pro-inflammatory molecules in females. So females might be more prone to chronic inflammation in general. Again, underexplored in ACL reconstructed population. So hard to make a definitive comment on that. But then when it comes to the rest of rehab, I love what you just said about we should not be doing cycle sync training. And I think that's gotten a lot of buzz lately and is a little bit trendy on social media. And there might be some kind of misconceptions that maybe we need to train differently during different phases of the cycle. And that's absolutely not true. We do not have the evidence to suggest that we should train differently during different phases of the menstrual cycle. But there are still areas where we could continue to explore this, I think. And I don't know that we've really done a good job in the ACL reconstructed population of considering if there are factors related to hormone expression or the menstrual cycle. And I think of the menstrual cycle more as a model of how hormones are expressed. So we can expect certain hormone profiles during phases of the menstrual cycle, but we need to be doing evidence-based menstrual cycle tracking if we're going to capture those hormone profiles.
I don't know about you, but I'm a big believer in just go after the basics. And I think one thing I've found certainly in my own rehab is when I've stayed true and consistent, things have moved forward. And when I've gone off script on a side quest, it's not gone well.
Yeah, and truly, the evidence does not suggest that we need to train differently during different phases of the menstrual cycle. Maybe we need to account for symptoms related to the menstrual cycle, but that's not training based. That's address the symptoms. If you as an individual have symptoms during certain phases, address the symptoms with interventions, but continue to train.
So let's come away from kind of physiology and let's look at biomechanics. Are there sex differences in movement post ACL with males and females? Kind of, do they move differently? Is there anything there?
Yeah, so preliminary evidence suggests that yes, they do. Very minimal evidence in tasks like gait. So there's some preliminary research that has identified sex differences in gait patterns where females are showing smaller joint excursions in their knee and the affected knee in gait compared to males. That said, these are very small studies. There's maybe about five or six of them, and they're very small sample sizes on the scale of 10 to 20 patients. So really not enough to make a definitive conclusion. There are a couple of other studies that have looked at more kind of like clinical based observation of movement. One is called the landing error scoring system, which is kind of a clinical assessment of if you do a drop vertical jump, how many quote unquote errors do you demonstrate in your mechanics of that task? And that study, I believe, was led by Chris Coons, and they did find there were sex differences. So they did find that females demonstrated more errors in the landing error scoring system compared to males. So there are some studies that have identified females are moving differently and maybe in a worse direction compared to males after ACL reconstruction. But again, this is really exploratory work. There's not that many studies there. I think there's room to explore this further, and I think there's a need for additional research in that space to determine what those differences are, so that then as clinicians, we can start to target and treat those differences and improve outcomes for females and improve movement patterns for females if there really are sex differences where females are performing worse.
Yeah, fair enough. Let's talk about rehab benchmarking, right? So I want you to hit this target. I want you to hit this. So are those benchmarks though? Because I certainly, as an older woman going through ACL rehab, I've been kind of looking at some of those benchmarks and going, I'm a bit older than probably the people that you've studied for that benchmark. Is there a difference there? Do females potentially have to hit higher benchmarks, or are they truly sex neutral?
Yeah, that's a really interesting question. And I don't know if we really have a good answer for that just yet. One thing to consider is the current evidence seems to suggest that we do have equivocal secondary injury rates between females and males. So we're not seeing that females are more likely to tear than males, which is great. So that suggests that if we're hitting those benchmarks, then we should be okay. That said, one of the big keys is it keeps coming back to the quads and quad strength, right? And evidence-based progression is going to include criterion of hitting certain benchmarks with strength, specifically with quad strength. And we know that females are struggling to get their quad strength back at a larger degree than males. So if females are struggling to hit that quad strength, they might progress slower and they might have a harder time hitting that benchmark and getting to the next stage of rehab or getting back to return to sport. And again, we know that females are less likely to return to sport. I don't necessarily know if that's coming from the quad strength isn't there, so then they're not cleared to return, or if there's something else happening in terms of decision making where they decide they don't want to return. But I would say that the benchmarks are fine based on the current evidence. I just would expect females to have a harder time hitting them.
It's interesting you bring that up because we've obviously done the kind of physiology side of things, biomechanics, and you're bringing in now the psychological. And I'm not trying to make this podcast all about me, but I am literally living this at the moment. And anytime I go to do something new, there is that, oh, should I? And I can't work out, is that because I know too much? But we know that female athletes do have difficulty returning sometimes because of the psychological side. So fear of re-injury is obviously a big barrier. And is that getting better? Or is that kind of still the same?
Yeah, it's still a huge challenge. And I wonder a little bit, this isn't based on evidence, this is me speculating. I wonder if the amount of kind of awareness that we bring to it and the awareness that we bring that females are more likely to have an ACL injury. I do wonder if maybe we're putting fear into athletes' heads, and then does that change their risk? I don't actually know the answer to that, but that may be a piece of it. Fear of re-injury is really interesting from the sex perspective, because there's a qualitative study that came out a little bit ago that found there's relatively even in terms of fear of re-injury. Males and females both demonstrate fear of re-injury. Where that differs, though, is what they're fearful with. So females are more likely, or we're talking more about fear of re-injury with daily activity and just general return to activity. Whereas the males in this qualitative study, we're talking about fear of re-injury and sport-related tasks and sport-specific movements. So I think there's something interesting there that we can probably further explore on the psychological side of rehab and understand better, like, where else do we see that difference? And is that going to then influence behavior? Or maybe why do we see that difference where females are more fearful in lower activity tasks?
And do you think there's a difference in confidence, self-efficacy, pressure to return? Because obviously it depends on what level you're playing at, obviously, but is there a sort of difference there between females and males?
Yeah, that's really interesting too. I don't know that we really know that from the current evidence. One of the main ways that we look at psychological readiness to return to sport is this scale. It's called the ACL Return to Sport After Injury Scale. And there's a bunch of questions on it that ask questions about confidence, about fear, emotion, and risk appraisal. They think they're likely to have another injury. And the existing literature is a little bit mixed, but it seems to point towards we might see lower psychological readiness in females than males. There's one really recent publication. It came out maybe a year ago. The first author on it is Dylan Roman, and he is a physical therapist at Connecticut Children's. So he did this work collaborating with lots of different institutions across the Pediatric Research and Sports Medicine Society. He didn't find statistically significant differences between females and males on this scale, on this return to sport after injury scale about psychological readiness. But he comments in his discussion that there is a trend towards slightly higher scores in males than in females. And there are other studies that have found sex differences in psychological readiness. So males are demonstrating greater psychological readiness than females. And then the interesting thing about confidence is there seems to be a little bit of a sweet spot in confidence where if you're too confident, you're at a higher risk of re-injury. Versus if you're not confident, you're also at a higher risk of injury. So we need this kind of middle ground where you have a little bit of confidence, but not too much.
It's so interesting that you say that because actually, when I think about it, I worry more about the ones that are super confident about going back than I do about the fearful ones. And I've actually almost pivoted to the fact that the ones that are kind of a little unsure, I'm like, that's kind of normal. I don't, obviously, if they've got major fear of doing anything in rehab, that's obviously an issue. But yeah, I have slightly changed tack on that because for a long time I was like, oh, there's real complexities in psychological return to sport. But actually, I worry more about the ones that, yeah, I'm fine. I'm like, okay. And actually, obviously, when the evidence came out and said that actually you're more likely to re-rupture because of that. But I also take your point on board from earlier on, where are we putting that fear into the patient's head? And I think that's is a key point because what comes out your mouth can be relatively just harmful for the patient. So let's talk late stage rehab then, and then return to sport. Are there, I mean, obviously about, but I think instead of this kind of psychological, the strength building phase at that point, because in this point, I've really felt I'm getting back to doing some of the things that I really want to do. Committing to the gym as much is difficult because obviously I'm still working full time. But I find those types of things quite challenging. Have you experienced the same that late stage rehab, return to sport can sort of A, slow down and B, become a little bit more challenging?
Yeah. So we know, again, I'm going to come back to the quad again. We know that there's deficits in quad strength a year out, multiple years out, decades out. And we also know that those sex differences are still persisting at this point, right? So even in late stage rehab, we're seeing that females are still weaker than males in their quadricep strength. And again, that might play into then if we're not hitting the symmetry or the standards that we want with quad strength, are we then not progressing into return to sport? And is that why we're not seeing our female athletes return to sport at the same rate? And that's probably a contributing factor. There's probably more than that going on as well. And then this is also where we start to see a divergence in physical activity. So if we look at athletes who are a year out or a couple years out, and we look at their physical activity by sex, we see that our females are something in the neighborhood of about 2.5 times less likely to meet recommended physical activity guidelines than uninjured or never injured controls. So at this point, they're well on their way. They're a year out, 2 years out. They should be back to physical activity, but for some reason they are not, and they're not getting as much physical activity as their male counterparts or compared to their uninjured counterparts. So I would say absolutely that is a very common experience, that it is challenging to continue being physically active and continue with sport at that late stage.
Yeah, yeah. I certainly think if you're like me, member of the general public, when life just takes over, it is so hard to continue to commit. And you also know that you've got that potential Biodex test coming, and then you're like, yeah, there's accountability there for sure. So let's talk about practical application and change then. What changes should clinicians and athletic development practitioners be making when rehabbing female athletes post ACLR?
Yeah, and I think there's a couple key pieces here. So quad strength is so important. We really need to be monitoring it and making sure that our female athletes are hitting those benchmarks and making sure that we're addressing it so that they do hit those benchmarks. And then I also want to give a little shout out to something I heard while I was at Isokinetic conference this April. So Amy Arundel presented in the first session. She did a great job outlining. She compared Reese James and Lauren James and their training ages when they made their professional debut. And it was not necessarily a surprise, but it was really nice the way that she outlined this and compared the two, because there's such a stark contrast in terms of training experience and training age in our female athletes compared to our male athletes. So I think it's really important for our clinicians and our practitioners to consider, are there training background differences when you're working with a female athlete compared to your male athlete? And if there are, we probably need to account for that in rehab, right? So this may have contributed to injury risk in the first place, and now we've had an injury, and we can't change that we've had an injury, but this can be maybe a reset button where we start to give them some of the tools and strategies that maybe they didn't have prior to this injury and capitalize on this opportunity to set them up for success.
It's difficult, isn't it? Because when you've got a season, for example, if you're playing games a lot, getting strengthening in season can be challenging. And that's where the off season obviously becomes vital. But you're probably with a female athlete still playing catch up because they haven't had that input when they've been younger.
Yeah, absolutely. Absolutely. And I do hope that in the next 5 to 10 years, maybe we're not having that same conversation. Maybe things have changed where female athletes are understanding how to train and how to strength train specifically at younger ages, where we're not seeing that happen with our current professionals or our current college age athletes. They didn't necessarily have that same access when they were younger.
And it's interesting, right? Because when I think about my own journey, my own sort of experience, in America, usually the kind of middle school athlete will have access to some sort of gym facilities. Now, you compare that to where I was in Scotland. I came across at 22 to the US and I was playing against people who'd been strength training for a good 4 or 5 years. I'd never seen the inside of a gym. And I was 22, I think, before I finally actually went into a gym. And I think I'd obviously missed out on a lot of that. But and I don't expect you to know the answers to this, but what I'm interested in is, what are the rates like in American high schools versus other high schools in Europe or in other continents? Because one may have more access to strength and conditioning coaches in gyms, and there will be differences as well because they play 3 sports a week. So there is that difference as well. But those sort of environmental issues cross cultures are interesting, right?
Absolutely. And I can speak to my own experience. I played soccer in college, I played soccer in high school. We didn't really do structured strength training at any point until I got to college. And even then, it was probably not as much as it should have been, because you get into the season and it's busy and there's practice and there's games and there's just not time for it. And frankly, I think me and my teammates, and I'll cop to this as an individual, I don't know that we held ourselves accountable in the off season to make sure that we were then getting our strength training in so that we were well prepared for season when that came around. So yeah, I think I don't know, that was over 10 years ago at this point, but I think there's definitely need for additional strength training and understanding of physical literacy and understanding of how to get into the gym and use your time effectively so that you're then prepared for your season.
It's interesting, isn't it? Because I think social media creates an awful lot of bubbles, right? So I'll often see female athletes in the gym, even younger ones in the gym. But is that the worldwide picture? Probably not. And I have seen definitely an Instagram uptick in females in the gym, but I don't know if that's just my little algorithm social media bubble or whether that is actually a trend that's actually happening. And I think it needs obviously a bigger study to look at that. But yeah, I do often think about, am I seeing real life or am I just seeing an algorithm bubble?
Yeah. Yeah. And I'm not working with teams enough to really understand what the practice patterns are. I will say our strength and conditioning team here at Arcadia is incredible. And I know that our teams are getting into the weight room and doing a lot of off-season training and during season training. But maybe that's my bubble. I don't know. I don't know if it's extending across the country or across different universities and programs.
Yeah, and that brings me on to another thing. Individualized training versus sex-specific frameworks. What's your thoughts on that?
Yeah, in rehab, especially, we always need to be advocating for individualized rehab and individualized training. We should be addressing specific impairments and addressing whatever deficits that the specific athlete in front of us has to get them back to where they need to be. But I think that falls within the context of understanding the sex-specific trajectories of rehab and understanding where we're going to expect our female athletes to maybe lag behind or not perform quite as well as male athletes, because that might be areas that we need to spend more time and attention to get them up to those benchmarks of where they should be.
And misconceptions, are there still a few around about female athletes in ACL rehab?
I think there's a couple. The menstrual cycle piece, which we talked about earlier, is a big one. Of just there's that buzz around, do we need to train differently during different phases? And absolutely not. And then the other one I think is the open chain knee extension, which we've talked about before, and that's not sex specific. I think there's still this kind of big misconception that we shouldn't be doing open chain knee extension after ACL reconstruction. And it's just not true. It's not true at all. There's plenty of evidence that suggests it's safe, or not just suggests, that strongly says it is safe to do open chain knee extension after ACL reconstruction. It's the only way to isolate the quadriceps muscle. So we should be doing it to regain strength. And yes, absolutely do some functional training as well, but we should be doing open chain knee extension.
Yeah. I've done a few of those over the last 12 months, I will tell you that. If you could change one thing about female athletes and how they're currently rehabbed after ACL reconstruction, what would it be?
Yeah, I just keep coming back to the paper about gender bias and what I just said earlier about what Amy Arundel said at Isokinetic is just prepare our athletes well. We really need to prepare our female athletes to get back on the field. And it requires an individual approach to each athlete based on how they're presenting and what their specific training experience is and what their specific trajectory after surgery is. But so many of our female athletes are just underprepared before injury and during rehab. So again, that rehab can be that reset button. That can be your opportunity to really prepare them well to get back on the field and also for the rest of their life, right? Because we know that there's physical activity differences. That's going to impact their health and well-being for the rest of their life, both their knee joint health and beyond. So, how they're moving and how much they're training and how active they are is really important. And again, use the rehab window as that reset button to prepare them well so that they have better long-term health.
And it may be a little bit of repetition, but is there a key sort of takeaway that you want practitioners and athletes to remember about sex differences in ACL, particularly for females?
Yeah, there's a couple pieces, right? We know that females have poorer outcomes, have poorer strength. Strength is associated with a lot of those outcomes, right? So if you get the strength better, you're going to see better patient-reported function. You're going to see better likelihood of return to sport. You're going to see lower likelihood of re-injury. And there's also emergent evidence that we might see psychological differences after ACL reconstruction. So those are the areas that we need to really be targeting and focusing on and making sure that our female athletes are hitting those benchmarks and getting to the same point as their male counterparts so that they can be successful in their return to play and beyond. And we might need to just spend more time on those pieces with our female athletes than we do with our male athletes. They might need more counseling about physical activity and health and in terms of the long-term health outcomes as well. And then on the research side, there's a huge research gap understanding the extent of all of these sex differences after ACL reconstruction. We really do need to explore it further. So maybe a little bit of a call to arms to other researchers out there who are interested in this area, or maybe some potential future researchers who want to understand why the sex differences are there or what other sex differences exist after surgery or in other populations as well, and other injuries. There's so much to explore here still, and we really need to continue the research that does explore it and answer some of those questions.
Fabulous. And it's been absolutely lovely to see you again, and many congratulations for defending your thesis. You thoroughly deserve that. If you are out there and you're working with female athletes and you're rehabbing them after ACL reconstruction, please ensure that you're holistic.
Thank you for listening to Women's Football Hub. The information within this podcast is for informational purposes only. No material on this podcast is intended to be a substitute for medical advice, diagnosis, or treatment. Please contact your doctor or another healthcare professional if you have any questions about anything raised in this podcast.